Hello, everyone, and welcome to this in-depth discussion on a critical topic, access to healthcare as a human right. In the next 7 minutes, we'll break down why healthcare is considered a fundamental human right, what that truly means, and the global frameworks that support this vital concept. For many, healthcare is simply a service, but an increasing global consensus views access to healthcare as an inherent human right, a fundamental entitlement that all individuals possess regardless of their socioeconomic status, location, or any other characteristic. This concept isn't just a philosophical ideal. It's enshrined in various international frameworks and declarations. These documents lay the groundwork for understanding and upholding this right globally. Perhaps the most significant of these is the Universal Declaration of Human Rights, adopted by the United Nations General Assembly in 1948. Article 25 explicitly states that everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including medical care. Building upon the UDHR, the International Covenant on Economic, Social, and Cultural Rights, ratified in 1966, further elaborates on the right to health. It outlines specific obligations for states to progressively realize the right to the highest attainable standard of physical and mental health. So what are the core components of this right to health? What does it actually mean for individuals and for states to uphold it? Firstly, there's availability. This means there must be sufficient healthcare facilities, goods, and services for all. This includes hospitals, clinics, trained medical professionals, essential medicines, and necessary equipment. Secondly, accessibility. This is multifaceted, encompassing non-discrimination, physical accessibility, meaning facilities are within safe reach, economic accessibility, meaning care is affordable, and information accessibility, meaning individuals have the right to seek, receive, and impart information on health issues. Thirdly, acceptability. Healthcare facilities, goods, and services must be respectful of medical ethics and culturally appropriate. This means care should be sensitive to gender, age, culture, and other diverse needs. Finally, quality. Healthcare must be medically appropriate and of good quality. This includes scientifically and medically approved standards, skilled medical professionals, and adequate infrastructure. Despite these established frameworks and core components, realizing the right to health faces numerous significant challenges globally. Economic barriers are a major hurdle. High costs of care, lack of insurance, and poverty often prevent individuals from accessing necessary services. Geographic disparities also play a role, with rural and remote areas often lacking adequate healthcare infrastructure and personnel. Social determinants of health, such as education, income, housing, and nutrition, profoundly impact health outcomes and access. Vulnerable populations, including indigenous communities, refugees, and those with disabilities, often face additional systemic barriers. Political will and governance issues also play a critical role. Insufficient funding, corruption, and a lack of effective policies can undermine efforts to ensure equitable access to healthcare for all citizens. Let's look at some real-world examples and global perspectives on how different countries are approaching this right. Many countries, such as Canada, the UK, and most of Western Europe, have implemented universal healthcare systems that aim to provide comprehensive medical care to all citizens, often funded through taxation. These models prioritize access over ability to pay. However, in many developing nations and conflict zones, the challenges are immense. Limited resources, inadequate infrastructure, political instability, and humanitarian crises severely hinder the provision of basic healthcare services, leading to dire health outcomes. Understanding healthcare as a human right has profound implications for policy and practice, demanding a proactive approach from all stakeholders. Governments bear the primary responsibility for ensuring access to healthcare. This involves allocating sufficient resources, developing robust health policies, regulating the healthcare industry, and establishing effective monitoring and accountability mechanisms. Healthcare providers, civil society organizations, and international bodies also have crucial roles. Providers must deliver ethical and quality care, while civil society advocates for marginalized groups and holds governments accountable. International cooperation is vital for sharing knowledge and resources. In conclusion, access to healthcare is not merely a privilege, it is a fundamental human right. While significant challenges remain, by upholding international frameworks, addressing disparities, and fostering collective responsibility, we can strive towards a future where everyone has the opportunity to live a healthy and dignified life. Thank you.